Welcome, everybody. My name is Dr. Balaji Sridhar. You can call me Dr. B. I'd love to talk to you about autologous stem cells and how they can be a powerful tool in regenerative medicine. So, I want to share with you how your own body's healing cells can heal themselves without having to use something from someone else's body and get you to the area you want to go to. I also want to talk about how these stem cells compare with other regenerative treatment options. So, a little background on myself. I have an MD degree, a PhD, where I studied specifically cartilage regeneration using biomaterial scaffolds. My PhD was in chemical engineering, and I learned a lot about the power of stem cells in healing and regenerating tissue. I also have a RMSK, which means I can do diagnostic and therapeutic ultrasound. The reason I got into regenerative medicine is I've also struggled with back issues and finally did some regenerative treatments when all other modalities in medicine kind of failed me, such as corticosteroid injections and PT alone, and found that with those regenerative therapies, I got 3 years of pain relief and feel much better and believe this is the future of orthopedic medicine. I'm also fellowship trained in interventional orthopedics and trained with a orthopedic surgeon who found that regenerative treatments had better outcomes than the surgeries themselves. And I'm also a board certified physician. So, how does regenerative medicine work? It works by stimulating your own immune system to heal the area. So, I just want to walk you through what typically happens. An injury happens, and then the body may neglect it over time, and that's why it can start to have chronic aspects of it, such as chronic pain. And so, what we do with these injections is we are stimulating your own body's immune system to come to the area and heal it. This will lead to tissue repair and long term healing compared to blocking a signal or going after something. These therapies work by working with your natural immune system to heal itself, which leads to longer term better results. I want to talk to you about three commonly used regenerative tools. The workhorse that a lot of people know of is platelet rich plasma, which is taken from patient's blood, harvesting those healing platelets by concentrating them and placing them in the area. Then there is autologous stem cells, meaning cells that come from your own body that can be harvested from either fat or bone marrow. And then these are placed into the affected areas. And then there are commonly, while illegal in the US, but they're still commonly provided, allogeneic stem cells, meaning they come from somebody else. And these therapies are come from someone else and then injected into an affected area. I want to talk to you about pros and cons of all three. So, in the autologous case, as I mentioned, they are taken from your own body and placed back into your own body, which means there is a low chance of rejection from your own body, immune rejection, or a lower chance of infection, because these are, again, coming from your own body, placed back in the same day. Allogeneic cells usually come from someone else. They can be fetus derived, placenta or something from some other patient. So, one, they're genetically incompatible. There's a higher risk of infection because of processing. And also, if it somehow bypasses all of those things, your body will reject it because it is not your own cells. And so, it will not create as effective a result. And so, we harvest autologous stem cells from either bone marrow in the pelvic crest or from adipose, meaning fat tissue, which contains a lot more stem cells. And they tend to be less inflammatory than the bone marrow cells because the bone marrow cells also contain white cells or those inflammatory cells I mentioned earlier. And so that's some of the benefits of the adipose compared to bone marrow. And so I want to make sure you are aware that these allogeneic cells might not, the things to be aware of, and these can be amniotics or products from umbilical cords. You may hear of it like that, or exosomes currently. All of these, the problem is they are not, again, coming from someone else. There's a higher risk of infection. There's a risk of rejection, meaning your body rejects these products. They may trigger an immune reaction. And there is a small risk sometimes of a graft versus host disease where the tissue that's being injected can attack your own body at times. So, this is why at Interventional Orthopedics of Washington, we focus specifically on autologous, meaning from your own body cells. And so, when should you consider PRP versus cell therapy? I like to think of PRP for uses in more mild to moderate cases and early osteoarthritis with smaller injuries, while I tend to think of cell therapy for more severe cases and you want a longer lasting effect that lasts for many years. I would lean towards cell therapy. I would also lean towards cell therapy with larger lesions or failed conservative therapy. PRP tends to work with growth factors, while autologous cell therapy tends to work with cells that not only release signaling factors, studies have shown they also, in the injected area, will differentiate into the tissue of need. So, I really want to talk to you about an interesting study that is done specifically with cells and the power of them. This was a study done in 2018, but followed patients for over 12 to 15 years. Think about that; it's a long time. And in this process, they directly injected cells into the bone. It's called an intraosseous injection. And we tend to do that when there are signs of severe arthritis, with what is seen here in slide 2 with this subchondral edema in this MRI, indicating that there's severe arthritis leading to damage to the bone. And so in this study, which was performed by a French surgeon, with this longitudinal study, all these patients either had this intraosseous stem cell injection into that knee, or they had a knee replacement. So one knee would be replaced, and one knee would have that cell injection. And then he followed these patients for up to 12 to 15 years. And wouldn't you know, it is really fascinating. But and these were again the same patients at 12-year mark, only 3% with the cells injected in their knee needed a knee replacement. Otherwise, at 12 years, most of them would avoid a knee replacement completely. And these were all patients who needed a knee replacement at the beginning of the study. While patients who had a knee replacement, up to 20% of them needed a revision, meaning another surgery at 12-year mark on average. So this study is really highlighting the longevity that these stem cells provide in just a one-time injection of these stem cells and avoiding the need for knee replacement, avoiding the risks associated with it. I find this to be fascinating. I find this is why I believe in these stem cells, as they can really help with pain and function. And so, what do we mean by long term healing with these stem cells? I want to emphasize that stem cells do take a little longer time to kick in terms of how you feel. Usually, by the 3-month mark, is when patients really start to notice that difference. The nice thing about the stem cells is they can last for many years, compared to PRP, which kicks in more around the 2-month mark, but more or less for a year to 18 months on average. And with this longer term relief, there's less frequency of flares, there's reduced reliance on medications, there's a chance to delay surgery, like I mentioned before, and the environment of that joint changes, which means it used to be a damaged joint, but after the cell injections, it's now a more healing environment, and thus that joint can last for a longer period of time. And so why do cells outperform PRP in some cases? The PRP is limited by its signaling of growth factors to the immune cells, while the stem cell therapy can not only signal to those immune cells, they can differentiate into tissue. And this is only possible with autologous, meaning from the cells. And then they can also recruit local repair pathways, and they are a more powerful source of healing than the PRP. And with cells, you do need to focus on rehabilitation, just like with any regenerative therapy. Usually, after that first week, you start to progress as tolerated and slowly start to get progressive gains. And then at that 3 to 6 month mark, your body may have remodeled at that point, and you can get long lasting relief for many years. One thing I wanted to say is not everyone responds immediately well. Rehab adherence is a key factor, comorbidities and patient factors. However, we optimize these factors at Interventional Orthopedics of Washington and know that it is a healing journey, but that cells give you the best chance of having the best outcomes for the longest period of time. And this slide is just to emphasize the need for rehabilitation, making sure you're strong enough in those areas and that lifestyle factors are optimized. And we can do that here at Interventional Orthopedics of Washington to help you through that journey. And while cell therapy is not a magic fix, by working on many different factors, we can optimize your chance for success and long term healing. I do want to emphasize that not everyone is the best candidate to start. There are things like infections, active cancers, poorly controlled metabolic disease, very big, very unstable joint with end stage collapse. These are things that cells alone can fix. And again, we can work with you to optimize these factors if possible. And also knowing that these aren't just a magic fix on their own. Patients need to be aware that rehabilitation and other things need to be optimized to get the best outcome. But again, these cells are very powerful in helping the body heal itself. And so, some questions I want to address: why not just PRP first? I don't always object to that. I think PRP is a great starting place for a lot of patients. However, if it is a very severe case and we know that the PRP alone would not do enough, we just recommend the cell therapy, especially if there is those subchondral edema in those severe arthritic cases. Autologous, in fact, does mean it is safer. How many treatments you need can vary based on severity and other factors, but a lot of times can be a one-time injection that can last for many years. Unfortunately, these therapies are not covered by insurance. While there is a lot of evidence to support them, especially for autologous cells, you will know really the true effect will take about 3 months for cells to kick in, and then you start to feel clinically better. We very much encourage PT and exercise after these injections, and that you will be back to activity within at least a week. We do not try to limit your activities too much. I will say that while I did regrow cartilage during my PhD with stem cells, these injections alone may not do that. But what we do tend to see is improved pain, decreased pain, and improved function after these injections. And when to consider surgery is for that severe cases with high instability and end stage collapse. I also want to highlight a paper I worked on as part of a team and published, showing that obtaining cells from fat using ultrasound yielded a higher cell quantity with a high cell quality, meaning more viable cells. So I was the lead author in this study, showing a minimally invasive procedural technique to harvest fat stem cells. And just want to highlight, this is a very good technique that we can do for specifically at Interventional Orthopedics of Washington to get you the best outcomes possible with high cell yields. And so finally, I just want to leave with some take home messages. Your own cells, meaning autologous stem cells, are the safest and effective option for orthopedic healing. Compared with PRP, stem cells provide a much more potent signaling and stronger repair capacity, especially for severe cases that are on the verge of surgery. And compared with donor cells, such as amniotic tissue or fetal products, the autologous cells are safer and more personalized and FDA compliant. Our clinic at Interventional Orthopedics of Washington uses evidence based, published approaches to working with cells. And as mentioned, we have published papers on how to harvest these cells effectively. So thank you for your time. And I do hope you consider working with us, and we'd be happy to answer any questions you have on stem cell therapy.